Well, I'm talking with Richard Horton, editor of the Lancet, who's here at the Global Health Metrics and Evaluation meeting. And Richard, I wanted to talk to you a little bit about, you made the connection between human rights and metrics. But before I ask you to explain that, generally, how has the global burden of disease been received by the global health community?
Well, Tom, I think people either love it or they hate it. Those who love it really love it because they can see this fantastic global collaboration coming together with a level playing field to figure out what's really big, what's changing, how fast it's changing, and that's an amazing achievement. But there are a lot of people who feel really upset about the way it's been done, that here is the Gates Foundation coming in with millions of dollars, blasting multilateral institutions out of the water, a kind of territory they've had for 50 plus years. And that's a very, very discomforting, disruptive process. And I think those people who want to defend the multilaterals feel that the way the GBT's gone about it has been, shall we say, not as diplomatic as it might have been. I think actually over the last year there's been a real rapprochement though between these two sides. I think a year ago it was real, almost hatred. What I see now, there was a meeting a few months ago in Geneva to try and calm this whole debate down. What I see now is that the two sides are much more constructively engaging with one another, finding the things that are good about each other, realizing that they can't all do it on their own, and I think we're in a much better place than where we were. So I have my fingers crossed that global health diplomacy is going to succeed.
So that's what global health diplomacy is. I always wondered what that meant. So let's talk about the point you made today, talking about that because of the data, we have an opportunity to marry human rights and health metrics. What do you mean by that?
Well, when I say to my friends back home in London, I'm coming to a conference on health metrics, they look rather sad for me. They must pity me, because what could be a more boring and dull conference than coming to talk about numbers and mathematics and models and computer simulations and all of this kind of thing? And I think that is a real danger, that the abstract, rather dry, arid nature of health metrics, the quants as they proudly call themselves, can come across as something that's totally removed from the reality of human beings in communities in the countries that we're most concerned about. And I think the health metrics community has got to figure out a way to reconnect itself with the real world, which it has not done a good job of doing. Equally, I think that the human rights community, which has fantastic rhetoric and principles and philosophies and wonderful ideas about what they want to do to create a better world, is totally divorced from the reality of data to guide what its priorities are. So here you have these two vast rivers of scholarly activity that are running in parallel with one another, and they barely touch. And when they do touch, there's usually this terrible electric reaction of repulsion between the two. And I think what the challenge is to use the best of health metrics, the concern with reliable information, with getting the best data, and then the advantages of human rights, which is about using those data to create a democratic, participatory, transparent way of figuring out what's right and what's wrong, what's a priority and what isn't. And then the two groups coming together in that final piece of figuring out what do we actually do now, what's the actions we need to take. And I think there's a real opportunity with a meeting like this to bring these two communities together. And if we could, it's almost the alchemy that we could get to really transform global health post-2015. Imagine it, Tom. Post-2015, we have the metrics community working with the human rights community in an era of sustainable development. We can do anything if we got those two groups working together. So that's the challenge.
That's great. And is there one good example of where you'd like to see metrics and human rights come together right now?
Well, I'll tell you the one example that I know most about, and so I'm a little biased, and that's around women's and children's health. So I think if you look at the Secretary General's, the UN Secretary General's Every Woman, Every Child initiative, it's a fantastic umbrella, bringing people together from many different communities around MDGs 4 and 5, child and maternal survival. That's great, but the problem is what you end up having is a lot of UN institutions, and you focus on the numbers and which countries are going up, which countries are going down, which countries are making no progress, and you can report fabulous data for 75 countries in the world where over 98% of maternal and child deaths take place. But what do you do about it? And the great failing of the UN system, the great failing of academia, is that we can't move beyond getting better numbers. And this is where the human rights community, with Universal Periodic Review, with the Human Rights Council, with the treaty bodies in human rights that we have, with human rights institutions in countries, with civil society participation, using national parliaments, we can use those mechanisms, there are many of them, to implant reliable data and get a political process going, and that's the goal.
I knew, talking to you, Richard, you could make numbers and statistics very exciting. Thanks.
Thanks, Tom.